Mr. President, I rise today to talk about the effort by the Republicans and in the majority about their effort to rip apart our health care system and jeopardize the protections for people with pre-existing conditions and to throw millions of people off of their health insurance. Now, it is deeply troubling at this point that with less than 24 hours to the expected vote, we don't even know which version of repeal Republicans hope to pass. Do Republicans support the Better Care Reconciliation Act, a bill that, according to the Congressional Budget Office, would cause 22 million more Americans to become uninsured, which would drive up health care costs and dismantle the Medicaid program? Do they support the Cruz Amendment, which would bring back junk insurance plans that offer virtually no protection and drive up out-of-pocket costs for vital services? Or will they rally behind their backup option, a plan to repeal the Affordable Care Act and replace it with nothing? That's nothing. An approach that would add 32 million more Americans to the ranks of the uninsured and cause average premiums in the non-group market to double. Or will it be something else entirely? We don't know. This is reckless. This is irresponsible. The American people deserve better. But let's be clear. A vote for the motion to proceed is a vote to move forward with conceivably any one of these bills. And all of these bills are terrible. They jeopardize life-saving care and treatment for millions of American families, especially those with pre-existing conditions. They tear apart our safety net and give tax breaks to powerful corporations. Let me remind my Republican colleagues that a vote in support of the motion to proceed will have real-world consequences for your constituents who may lose their health insurance. Perhaps these are people you've met, people, many of whom may be losing sleep out of justified fear that their children or their parents, their loved ones, or they themselves are at risk of losing their health care. I have talked to so many people in my state about these dangerous proposals. There's Christy. Christy is a young farmer in greater Minnesota whose husband and two kids relied on Medicaid to access care when their farm was struggling. There's Sandy, whose mom is in a nursing home, who doesn't know how she will pay for the round-the-clock care that her mother needs if Medicaid, which covers more than 6 in 10 nursing home residents nationwide, scales back coverage. And then there's Sherry, who said that if it weren't for Medicaid, her son Brandon, who has cerebral palsy and hydrocephalus, probably wouldn't be here. I met Brandon. I think he's 18, 19. He was born 15 weeks early in the metro, in Minneapolis. About 1.5 pounds. They took him to the Mayo Clinic in Rochester. The Mayo Clinic said, we can't do that. We can't handle him. So they sent him back to Minneapolis to Gillette Children's Hospital, which could. They told Brandon's parents he's going to require $1 million in care the first day to save his life. Brandon's had, I think, 37, 38 surgeries. He spoke at a meeting we had on Medicaid a couple weeks ago in Minnesota. And he stood, he had a walker. He's just gotten an A- on his first college course. He was actually, in a way, the last person in the room I was worried about, because his resilience, this kid, is going to be amazing. But I don't think he'd be here if we didn't have the kind of Medicaid we have and the kind of Medicaid that my colleagues on the other side of the aisle are talking about limiting in a way that will affect so many people that I've met across my state. This is one of those votes that will go down in history. It's one of those votes that all of us will be answering for wherever we go for the rest of our lives. Former Republican Senator from Minnesota, David Durnberger, outlined some of the reasons why senators should not vote for this consequential legislation in an excellent op-ed piece that he wrote in that was in USA Today today. Senator Durnberger, again, Republican from Minnesota, someone who I talk to a lot about health care, wrote this piece saying, resist the bullying, don't vote for a mystery health care bill. I would ask unanimous consent to add Senator Durnberger's op-ed to the record.
Without objection.
Thank you, Mr. President. You know, there aren't many votes like this in a senator's career. So let's just lay this out. If you support the vote tomorrow, the following are some of the specific consequences that could follow. In many cases, would follow. First, it is a vote that would open debate on bills that would undermine protections for people with pre-existing conditions. This could happen in one of two ways. This vote could open debate on the potential Cruz Amendment, which would allow insurance companies, as long as they offer ACA-compliant plans on the exchanges, to also sell bare-bones, skimpy plans outside of the exchanges with almost no consumer protections. Under this amendment, insurers would be allowed to deny coverage and charge higher rates to women, older adults, and individuals with pre-existing conditions. To my Republican colleagues, do you know someone who's pregnant? Do you know someone who has diabetes, asthma, depression, cancer, multiple sclerosis, substance use disorders, arthritis, dementia, sleep apnea, Parkinson's? All these people could be denied coverage under the Cruz Amendment, just as they were prior to the ACA. The Cruz Amendment would also bring back annual and lifetime limits, coverage exclusions, and more. When I was campaigning in 2008, and I would go around Minnesota, cafes, VFW halls, bars, there'd be a flyer up for a family that had gone bankrupt because someone had gotten sick. This would bring back those annual limits, those lifetime limits. Do we really, really want to go back to that? The Cruz Amendment is intended to deceive. The amendment is designed to make people think that it would lower premiums since it would allow insurers to offer stripped-down plans that don't comply with the ACA's consumer protections. But what it actually does is skyrocket the price of insurance for people with pre-existing conditions like epilepsy, Crohn's disease, and stroke, while eviscerating the quality of insurance for those who don't yet need or know they need such coverage. In fact, America's health insurance plans, which is the National Advocacy and Trade Association of companies that sell health insurance to Americans, and the Blue Cross Blue Shield Association have said that this proposal is, quote, simply unworkable in any form and would undermine protections for those with pre-existing medical conditions, increase premiums, and lead to widespread terminations of coverage for people currently enrolled in the individual market, unquote. The fact is that these high-deductible, bare-bones plans are a dangerous ripoff. And many people won't even realize what garbage insurance they have until it is too late. But here's the thing. Even if the Cruz Amendment were removed from the bill, the Better Care Reconciliation Act would still undermine protections for people with pre-existing conditions. That's because the bill would allow and even incentivize states to waive ACA protections, like the guarantee of coverage for basic essential health benefits. If you are allowed to offer plans that don't cover basic services like mental health, prescription drugs, and maternity care, then you have a backdoor channel to charge people who need those services more than those who don't. And not only that, states that seek waivers and end the guarantee of essential health benefits bring us right back into the world of annual and lifetime limits, a world where your care would end not because your doctor said so, but because the insurance company would stop paying for it. This could be true even for people who get their health insurance through their employer. In fact, even if you work in a state that hasn't taken this waiver, your employer could have gotten their health insurance from a state that had. In short, with or without the Cruz Amendment, the Better Care Reconciliation Act breaks President Trump's promise to protect people with pre-existing conditions. Second, a yes vote tomorrow is a vote to end Medicaid as we know it. Medicaid is a lifeline, providing health insurance and access to care for more than 70 million Americans. That's about 1 in every 5 Americans. It includes seniors, pregnant women, people with disabilities, families with children. You know, Senator Klobuchar was right about this being a lottery. Any of us can be in an accident. Any of us can be diagnosed at any time. Any of us can have a child who's diagnosed at any time with something unexpected. Healthcare really should be a right. I don't understand people who say, I'm healthy, my kids are healthy, why should I suffer? I'm the victim here. Nothing's happened to me. Why should we have a system where I'm paying for people with pre-existing conditions? Really? Is that the attitude that my Republican colleagues are taking? Because that seems to be the logic. Medicaid has been a bedrock of our healthcare system since 1965. It was and is a federal promise made to states and to all Americans over 50 years ago. And most of all, Medicaid works. But the Better Care Reconciliation Act would gut it. It would end the program's coverage guarantee, leaving states to either roll back coverage or slash other vital programs in order to meet their citizens' needs. And finally, Mr. President, a vote to support the motion to proceed to this bill is a vote to drive up people's total health care costs. The Republican plans decrease or eliminate the ACA's tax credits, which help people afford their insurance. That was part of the construct. And it dramatically hikes premiums for older Americans, although one's younger than me. I'm now 66, but from 50 to 64. And it drives up deductibles and other out-of-pocket costs that many people will have to pay in order to receive care. Americans don't like these proposals. In fact, new polling shows that only 17% of Americans think that they and their families will be better off under the Republican plans. That's 17%. What Americans want is for Republicans and Democrats to work together to build on and improve the Affordable Care Act. So why do my Republican colleagues continue to push forward on these terrible bills? It doesn't have to be this way. There is another option. This body can reject these wrong-headed and really ill-thought-out proposals and allow for an open, bipartisan process under regular order where we can work together and do the things the American people actually sent us here to do: expand coverage, lower costs, and improve care. We should have bipartisan hearings where we hear from nonpartisan expert witnesses about the challenges facing the Affordable Care Act so we can work together to fix what isn't working about the ACA. What we do know from the last few years is that coverage matters. This is important. Coverage matters. Just having coverage matters. The health care isn't really about these big, heroic emergency. There are some of these, but what a person's health is about, those events. What it's really about is having coverage and getting continuous care throughout your life. Rigorous studies have shown that for every 300 to 800 adults who get coverage, one life is saved per year. And research summarized by Atul Gawande and his colleagues in a recent New England Journal of Medicine piece finds that health coverage expansions have improved people's access to care, improved their financial security, meaning fewer bankruptcies and medical bills sent to collections, improved chronic disease care and outcomes, improved self-reported health, and more. Overall, health insurance has been shown to help Americans live longer, healthier lives. Now is not the time to roll back our progress. I urge my Republican colleagues to think about what a vote for proceeding on this terrible legislation would mean for the American people. Paul Wellstone said that politics isn't about winning. It isn't about money. It isn't about power. It's about improving people's lives. Our constituents sent us here to improve their lives. So I urge my Republican colleagues to vote no. Let us work together to fix what needs to be fixed about the Affordable Care Act and do all that we can to make sure that people have access to affordable, high-quality health care when they need it.